So, not all acne should be treated the same way, and starting treatment at the wrong time can actually make the skin worse. So, sometimes what looks like treatment failure is really a timing issue. And in this video, we're going to look at how to tell when acne is truly ready for intervention and when it's better to pause, stabilize, and prepare the skin fast. So, one of the most common patterns I see is urgency. There's a flare or a period of improvement or frustration after trying multiple things, and the immediate instinct is, I need to start something stronger. But acne is not just about strength of treatment, it's about context. If underlying inflammation is still unstable, if the barrier is compromised, if triggers haven't been identified, then even appropriate treatment can actually backfire. So, timing matters because treatment works best when the skin environment is predictable, when inflammation has calmed enough, when patterns are clear. So, this video is about helping you recognize that window when intervention will actually work with the skin and not against it. So, when I say acne is ready for treatment, I don't mean it has disappeared. I mean, the skin has stabilized long enough that treatment can be introduced in a controlled way. So, there are three indicators, and one is reduced acute inflammation. This doesn't mean no acne. It means lesions are not constantly erupting, spreading, or escalating in severity week to week. If every week a new wave of intense inflammation is happening, then you're layering active treatment on top of that. Often you're compounding to irritation. Second is consistent pattern recognition. You should be able to identify at least some level of predictability. For example, breakouts clustering around the chin is a cyclical pattern. Congestion, primarily around the forehead, flares linked to specific environmental or behavioral triggers. When acne shows a pattern, it becomes treatable in a targeted way. When it's random and shifting constantly, that tells us the underlying drivers may still be unstable. Third is barrier health. The skin should be able to tolerate basic cleansing and moisturizing without stinging, tightness, or excessive redness. If even gentle products burn or the skin feels persistently fragile, it then is not ready for active intervention. Treatment requires tolerance. Without barrier resilience, you end up treating irritation instead of acne. So there are clear signs that acne is not ready for escalation. So highly reactive lesions are one of them. If spots swell dramatically, spread quickly, or leave significant post inflammatory pigmentation after minimal trauma, the inflammatory response is still heightened. That tells us the skin environment is unstable. Another sign is constantly changing presentation. If one week it's inflammatory papules, the next week is diffuse redness, then suddenly dryness and flakiness, the skin is not settled. So, adding actives at that stage often leads to overuse, stacking ingredients, chasing flare ups with stronger products. And what happens then? Barrier compromise, then which leads to more inflammation, which is mistaken for acne progression. And the cycle continues. A third major red flag is routine instability. If products are being changed every few weeks or multiple actives are introduced at once, you cannot accurately assess response. When there are too many variables, you don't know what is helping and what is harming. That is not treatment phase. That is actually experimental phase. And experimentation should end before structured treatment begins. In clinical practice, timing influences outcomes more than most people realize. So, when treatment begins after inflammation has settled and patterns are understood, several things improve. So, lesions will resolve more predictably, there's less rebound inflammation, post inflammatory pigmentation is reduced because the inflammatory cascade is actually shorter. And perhaps most importantly, fewer adjustments are actually required. So, when acne is treated too early, the skin often reacts unpredictably. This leads to stopping and restarting products, escalating too quickly, or abandoning treatment entirely. But when timing is right, treatment progression feels steady rather than chaotic. So that difference is not about stronger products. It's actually about introducing intervention into a stable environment. So, what should happen before treatment begins? So, preparation. So, first, identify patterns. Location matters, jawline versus forehead, cyclical versus persistent, inflammatory versus congestive. Second is reduce variables. Simplify the routine. Stop layering multiple actives. Allow the skin to settle into consistency. Third is support the barrier function. So hydrate, gentle cleansing, sun protection. So these are not secondary steps, they're actually fundamental. So when the barrier is intact, actives perform more predictably and cause fewer secondary complications. So preparation may feel slower, but in reality, it shortens the overall treatment timeline. So, understanding readiness changes how you approach acne. So, instead of reacting to every flare, you start observing patterns. Instead of escalating immediately, you stabilize first. And once the skin is ready, treatment becomes strategic rather than reactive. In the next video, we'll look at product logic. So, which ingredients actually support acne resolution, which ones are often misused, and how to build a treatment plan that makes clinical sense. So, like, share, and subscribe.